If you were on your way to work, heading down the freeway at 85 miles an hour, and suddenly the check engine light appeared, would you, A, pull over, pop the hood, and get to work? B, treat it like you treat the low fuel gauge? You've easily got another 40 miles. Or C, slap a piece of duct tape over that light so you don't have to see it at all. Because we wouldn't want to interfere with your texting now, would we? So in healthcare, we are actually at our best when we pull over, pop the hood, and get to work and fix the acute physical problem. Now, you've got pneumonia? I've got antibiotics. Oh, you've got a heart attack? I bust clots. Your appendix bursts? Within minutes, we'll perform life-saving surgery. So in a crisis, we're actually miracle workers. Now, as health professionals, we have values. We value data, we value service, certainty, and results. Now, we use that as a platform from which it empowers us to serve millions of patients every day. Yet, how can it actually be that despite all the advancements in medicine, somehow healthcare costs are spiraling out of control and stress-related chronic conditions are on the rise? Well, we know from being at this conference and just being patients ourselves that patients are pretty smart because they all head to Dr. Google when they don't get the long-term solutions from us that they seek. Now, in parallel with this happening is also the epidemic that more than 60% of frontline physicians are now reporting at least one symptom of burnout. Now, that rate has doubled in the last 2 years. So one reason for these trends, I believe, is that whenever we hit a roadblock or an obstacle, our first line of thinking kind of moves towards, well, maybe we just need to do more of the same, just faster. Now, the big problem with that is it relies exactly on that. It relies on our belief that we're right to begin with. And this causes all sorts of problems. So what if our weaknesses, right? And let me back up. This causes all sorts of problems because the first one is there's no expansion of our thinking. The second problem is that we don't acknowledge or address our weaknesses. And probably the biggest result of this is that we don't allow ourselves or create the environment for us to adapt, grow, or change. So what if our weaknesses were actually the secret to solving some of our biggest dilemmas in medicine? And what I mean by that is, what if a weakness is just a strength overused? So think about that for a moment. Because what if we've been relying too heavily on these values and now they're actually undermining us? Let me tell you what I mean by that. So let's start with data. We are amazing at gathering and analyzing physical data, symptoms, blood tests. But when we only rely on the physical data, we miss the mental, emotional, social, and spiritual data that only the patient can provide. And we've spoken about that many times, even this morning. So what about service? So being in service is noble. Except when we care so much about someone else or what other people think of us that it undermines our own self-care, now it's a problem. Certainty. So we're in the business of life and death. And no one's going to argue that it's important to get it right. Except too much certainty actually turns into arrogance, which undermines the trust between the patient-provider relationship. And all we need to do is add a little curiosity, and then we can help our patients be empowered to help us find the solution that will be customized for them. Now, lastly is results. Okay, everybody wants results, preferably immediate results. But when what we're doing is taking short-term fixes, using them over and over again, and labeling that a long-term solution, it's no wonder that we're kicking the can down the road, and it's no wonder that these costs are rising so quickly. Now, Everyone here knows one thing for sure, that your headache isn't an Advil deficiency. Right? That's like slapping a piece of duct tape on the check engine light and hoping for the best. You're going to get through your next deadline, but it's going to do nothing to prevent your next headache. But never give up hope, because there is a way to transform these weaknesses back into strengths, right? We need to expand our thinking, and we need to address the issues on the level that they're actually occurring. So let's take a common example that has given a headache to many a provider. So let's say I'm in the hospital setting and I've successfully ruled out a heart attack. So my list is going to get smaller of my patients, so I triumphantly walk into the patient's room and declare, Mary, great news, because all your lab tests came back normal. You can call your family and start getting ready to go home. But doc, I don't actually feel well enough to go home. Can I stay a little bit longer to make sure everything's okay? I mean, sometimes I'm having this shortness of breath and I can feel my heart beating. Can I just stay one more day? Mary, so you're physically stable, and that means you're perfectly fine to go home. Now, if what you need is for me to go over all the individual lab results with you so you better understand, I can do that. Okay, that's the moment where our patient satisfaction scores just took a big nosedive, right? Because I've entered a losing power struggle with my patient, and really the most important thing is that patient is going to walk away from that conversation feeling unheard. So too often what we tend to use in medicine is what I call single vision. It's when we're focusing so intently on only the physical data. And in order to get to the root of this, we have to take off the duct tape, we got to look under the hood, and we have to use what I call double vision through expanding our thinking. So let me do a take two on that one. So instead, I would reply to Mary and say, wow, Mary, it sounds like we actually have some good news and we have some bad news. The good news is that your heart and lungs are strong, and so you didn't have a heart attack. The bad news is that you're still feeling this shortness of breath and feeling your heart beating. So that must be really scary. Now, one thing that's coming to mind is that sometimes when concerns are not addressed on a mental, emotional, social, or spiritual level, they can sometimes show up in your physical body to get your attention. So I'd like to write you a different kind of prescription, but I'm going to need your help. So would you be willing to answer a few questions in order to help us get to the root of what might be happening? Of course she agreed. In fact, I did this with thousands of patients, and they always agreed. This is called the patient awareness prescription. Now, I'm going to show this to you, the questions that address 5 different aspects for a patient to think about. What I want you to know is it took me a decade of seeing patients to make this clear and concise. This printed up on one sheet of paper could take you 3 to 5 minutes to do with a patient. So let's begin with the first aspect. So on a physical level, could you rate on a scale of 1 to 10, with 1 being poor and 10 being excellent, your self-care in each of these areas? So your nutrition and whether you're eating whole foods, your quality and quantity of sleep and the regular circadian rhythm when you're going to sleep and waking up in the morning, your movement, and I don't just mean do you walk 3 times a week, I mean do you enjoy moving in your body? And on energy, do you feel a consistent level of energy throughout the day? Secondly, I asked them to jot down what are the top 3 repetitive thoughts occupying your mental real estate? You know those thoughts that when you wake up in the morning, it's the first thing you're thinking about? Those. So your top 3 repetitive thoughts. Third, on an emotional level, we know stress causes or exacerbates more than 90 to 95% of all illness. It's really important. Could you please rank which arenas in your life are causing you the most stress from highest to lowest? Your significant other, family, social, health, work, or money. Now, because it's really important who we surround ourselves with, and that greatly influences us, I ask them to tell me who are the top 5 people you spend the most time with. And of those people, who net gives you energy, right? And who mostly drains you of energy. Really important to become aware of this. And then because it's not only important to be connected to each other, but it's also important to be connected to something bigger than myself, maybe a purpose or a meaning greater than me, I ask them about their spiritual health. And I ask them what they value about their work, whether their work is in the home or outside the home. I ask them what matters most in their life. And probably most profound is for them to describe a time when they felt a deep sense of connection and belonging. And this usually can inform them about what matters most in their lives. So once my patients finish this prescription, they have an expanded awareness of what's happening, and they now have double vision. So I follow up with, given these new awarenesses, what else might be contributing to your physical symptoms? And what might be the next step that you need to take in order to feel better? So let's talk about Mary. Because after she had a chance to reflect on these questions, she said, Doc, I gotta tell you, I think I figured it out. These sensations of shortness of breath and she didn't call it palpitations, but she was talking about palpitations in her heart. She said, once I reflected on these questions, I realized that was the anxiety because I'm so scared to go home alone after my recent divorce. And then she followed it up with her second step, which is, and the next step I need to take is I've been meaning to get an alarm system for my home, but I just haven't done it, but I think it'll really help me feel safe and secure. And on top of that, all my family and friends have been offering to come over and fix me food and spend time with me, but I've been telling them I'm strong, I'm okay, I'm fine. And I think maybe I'll invite them to help me through this transition by building a different community now. And so I just thought to myself, wow, extending her hospital stay one more day would have cost us more time and energy, and most importantly, it wouldn't have solved the problem. So it was pivotal for me to get curious, and I really liked earlier today when they were talking about inspired curiosity. It's my job as a provider to use inspired curiosity to empower my patients to help me help them. So now I want to take a moment to move our attention to providers, because listen, we've got some issues that are also not being addressed. One of them is burnout. So it's not a surprise that doctors and providers are burning out at a very quick rate. What is surprising, though, is the way we treat burnout. Now, I've burned out myself as a physician. That was in 2004. So I've seen the system as both a patient and as an internal medicine physician. My thought on this is that maybe instead of the current prescription that we use, which is reluctantly giving someone 10 days of stress leave, followed by some combination of Prozac, Ambien, and Ativan for their symptoms. And if I'm really progressive, what I do is I actually will say, how about a few counseling sessions and a stress management course, or maybe even yoga? Now, that's if I'm really progressive. And then, miraculously, 10 days later, I expect a new and improved version of you to show up back in the ring for round 2. So exactly what quality results are we expecting with that prescription? So I actually am advocating that we do a nuanced version of the prescription I give to my patients, except maybe as providers, we could benefit from this. And it would be similar, but a little bit different. So I'd ask us, so do I prioritize my own self-care at the level that I advocate for my patients to? And I would have them rate these same categories. On a mental level, not only do I need to write down the top 3 repetitive thoughts occupying my mental real estate, but I also need to pay attention to knowing that sometimes I really want to get it right, so much so that my pursuit of perfection sometimes leads to diminishing returns, and I'm my worst enemy. So that's the second question I want to figure out. Where is that occurring? Emotionally, now, Providers can be known in the name of saving time and energy to avoid some conflict and sweep the emotions under the rug, thinking that they're going to go away, but actually what happens is they turn into blame and resentment. And that will explode at the most inopportune moment. So emotionally ask yourself, in what areas of your life are you avoiding conflict or difficult emotions? And rank that from highest to lowest. And socially, sometimes we start to, when we're burning the candle at both ends, we tend to kind of start conserving our interactions and just conserving our energy by minimizing our interactions with others. This leads to isolation and a feeling of being unappreciated and unvalued, so it compounds the problem. So socially, you want to ask yourself, in what setting and in whose presence do you feel empowered? And in what setting and whose presence do you feel powerless? And probably a clue before you feel powerless is when you start to notice yourself behaving passive-aggressively. That's a good clue. Now, burnout is a wake-up call. Its roots are a breach that often began on a spiritual level. Because somewhere along the way, we started making decisions that had us deviate from what was most important to us. And some of us even went as far as disconnecting from why we went into medicine in the first place. And so it's really important for you to ask yourself, recall what first inspired you to become a health professional. And describe a time when you felt deeply, deeply appreciated and valued. And then take it bigger from there and ask yourself, what brings you purpose and meaning in your life? Because now you'll have double vision, and you can ask yourself what the next step is, because you'll have this expanded vision of burnout, right? You'll be able to see it on all these levels. Now you ask yourself, what's the next step for me to reinvest in my own self-care? So data, service, certainty, and results, they are very useful, and they've served us well. And we've now learned that sometimes when we overuse them, they're the problem. So pay attention if you're gathering information on a physical level only, looking for immediate results, and if it works, you're great. Now, if it doesn't, and you start noticing the same problems, the same issues resurfacing again and again, it's time for you to write a different kind of prescription. One that's not only for your patients that's different, but maybe even one for yourself. And it's one that includes curiosity, that expands your thinking, and it creates double vision. Thank you.